Hello, class. My name is Sean Johnson. Today, I will be giving you guys my presentation on type 2 diabetes in HIV positive females in Atlanta, Georgia. Now, just a small background of diabetes as a whole. There are two main types of diabetes. There is type 1 and there is type 2 diabetes. Diabetes is a disease that occurs when your blood glucose levels are above the normal levels of the body's. Diabetes is one of the leading causes of blindness, kidney failure, heart attack, stroke, and even amputations of your legs and arms. Diabetes is a very costly disease, and it affects more people in the world than you can even count in your head. Now, to focus on strictly type 2 diabetes, type 2 diabetes is the most common type of diabetes. You can get type 2 diabetes by sedentary behavior, lack of exercise, or even just your unhealthy lifestyle choices. Type 2 diabetes occurs when the body's need for insulin outweighs the body's ability to produce insulin through the use of the pancreas. The pancreas is used to produce insulin. Most people with type 2 diabetes are insulin resistance, means that their bodies do not work well with insulin. Now, just an overview of HIV. HIV is a virus that attacks and destroys the body's immune system, which is used to fight off infection. You can get HIV through unprotected sex, any type of exchange of body fluids, or exchange of dirty needles. And AIDS is the most advanced stage of HIV. Risk factors for HIV include unprotected sex, homosexual behavior, and injection drug use. Risk factors for type 2 diabetes include being overweight, a BMI, which is body mass index, greater than 25, sedentary lifestyle, and also a family history of diabetes. Just to list a few complications of type 2 diabetes, it includes nerve damage, heart disease, stroke, high blood pressure, nerve damage, and blindness. Now, complications of HIV. Living with HIV can result in a very, very weakened immune system, and it can make your body susceptible to different type of infections such as tuberculosis, chronic pneumonia, shingles, and fungal infections. And also, other complications of HIV include mouth sores, dementias, and eye infections. If you have both type 2 diabetes and HIV, please be aware that some HIV medications may increase the risk of high blood sugar. People with HIV should have their blood sugar levels checked regularly and before they start taking any HIV medication. People with higher than normal blood sugar levels may need to avoid taking certain HIV medications so they won't have to see a doctor just because of blood pressure problems, blood sugar problems, and blood glucose testing is important after starting HIV medications. To continue on, if you are HIV positive and have type 2 diabetes, please talk to your healthcare provider about the link between type 2 diabetes and HIV. Type 2 diabetes and HIV can slow down your body's ability to fight infection, which is a very, very serious problem. High sugar levels in your body allow bacteria to grow. Some of the sites for infection for diabetes and HIV is the bladder, kidneys, eyes, gums, feet, and sexual organs. Early treatment of type 2 diabetes and HIV can really prevent problems later on down the road in your life. Next, for my target audience, a lot of you guys may have asked questions and said this is a very interesting topic and why did you choose this topic? And I had received a lot of feedback from my target audience, but the target audience that I chose was HIV positive females in Atlanta, Georgia that have type 2 diabetes as well. Also, these women include women who attend Grady Hospital outpatient clinics. This includes newly diagnosed patients, hospital inpatients, and women who want more support or more education on both HIV and type 2 diabetes. Behavior intervention will more than likely address the issue suffered by women diagnosed with type 2 and that live with HIV. There are barriers of treating African American women who have been diagnosed with HIV and type 2 diabetes. Some barriers include poverty, lack of education, and for some reason they're being discriminated against because they have both HIV and type 2 diabetes, making them lonely and feeling depressed because they feel like they cannot have the adequate help that they need just because they are facing these deadly diseases. Now, there is a way to communicate with these women. Even though it may sound very hard, it's always a way. Women that are identified by healthcare professionals will be solicited to give their contact information in order to receive additional information. Additional information will be email, text, or sent to their home. Now, the additional information will include who, what, when, and how of the program, and it will give them all the basics of the program. The method of communication for these women may include personal home visits. Personal home visits may be important because I feel like if you sit down one-on-one with a woman and they tell you their problems and you kind of understand where they're coming from and they understand you and how serious you are about helping them, that'll make them feel more comfortable and open to any suggestions and to any help and education that you may have for them. Tone is very, very important. And the way you come off and the way and how you say things is very important to women. Now, in my ways of addressing these women, I will use a more friendly tone because I want them to know that first of all, that I come in peace. In addressing the issues, I will use a more humorous and non-judgmental tone. Humor will demonstrate love, compassion, and acceptance for those with type 2 and HIV. And non-judgmental, now the non-judgmental portion of it comes about, people wouldn't want you to help them if you judge them, especially not me. And I feel like if you're going to someone non-judgmental, I feel like they're going to give you their all and they're going to like open up to you and they will relax the mood. And a more humorous tone will decrease the embarrassment and help with discussing health complications, treatments, and behavioral changes. How would the program work, you may ask? The support team may conduct face-to-face visits in the home on a regular or irregular basis. Now, the one-on-one face-to-face visit shows that you're willing to help. First of all, you're willing to drive out and help, and you're willing to show that how serious that you are to help them. In addressing the issues, use of impromptu meetings at treatment clinics, text messages, email, and social media might be considered suitable, but I still would go with more of the educational route. It will be important to educate the target audience in a simple and understandable language. Having friendly walks, meals, and talks may help some women feel more included and less alone and depressed. And I know I didn't include any graphs or charts in my papers. That was kind of wrong of me, and I apologize, guys. But I have a few graphs on here. I have the zip codes with the highest HIV and AIDS rates in the surrounding counties of Georgia, particularly Metro Atlanta area. And I also have a graph of the number of women and girls estimated to be living with an HIV diagnosis in 10 states, with Georgia having 8,700 women living with HIV and AIDS. And I also have a depressive symptoms and risks of type 2 diabetes in women. And also included a prevalence and age-adjusted rates charts. You guys can go look at that. And for my prevalence of diabetes for Black women, I got 13.1% out of 100,000. Man, that's a pretty large number. And that really concludes my presentation. And I hope I answered everyone's questions, and I hope I cleared things up, and I hope I added information that I was critiqued on. And I appreciate everyone's feedback, and it really helped me become a better writer and a better researcher and a better student. And thank you, guys.